Dr. Nathan, and as part of our educational series, we're going to be talking about jaw pain or TMJ dysfunction. Okay, let's start with the anatomy of the jaw. So the jaw is two major bits for it, and that is the condyle from the skull and then the mandible from the jaw. Okay, what these allow for is opening and closing movements, just like a hinge joint, but this is a modified hinge joint. And what that means is it allows for that translation forward of the jaw. Now, in between the two bony prominences, we have a cartilaginous disc, and sometimes that disc will slip forward or back or to the side, and that will create a locking sensation. So when we see people, they might have their jaw locked in the open position or in the closed position, and they might have to physically use their hands to open up that jaw. Okay, in terms of why does this occur, well, we've seen two cases. So basically, in the trauma aspect, you might get a knock from the side in your sport, whether that's netball, basketball, soccer, rugby, football, and that will create dysfunction in the jaw. Okay, we've also seen it after people have had their wisdom teeth removed. There might be a bit of trauma aspect to that, and it will create dysfunction into the jaw. The other type or subclass that we've seen it in is people that repetitively chew. So whether that's chewing gum, chewing meat, whatever it is, over time we've seen that happen. Okay. In terms of treatment and assessment, so if you were to come to see us as a chiropractor, what we'd be looking at is the function of the jaw. So how it opens and closes, what movements you can and cannot get. Okay. What we're looking for is the jaw to not deviate. Now, if it deviates on either side, it would suggest that when you open it, and let's say it goes to the right, that the right TMJ is the problem. And you might feel on the left, but it's suggesting that the right is dysfunctional. Okay, so that's typically what we would want to look at adjusting. Okay, now it's very important, whichever healthcare professional that you see, that they assess the muscles that control the jaw. All right, these are usually the pterygoids, both medial and lateral, and also the masseter. They tend to go extremely tight and painful. So that's something that we would look at. Okay, now if you'd like to know anything else, or if you have any more questions about jaws, please give us a call. Find our number.